nurse from Cedar Crest College today, and I'm going to be working with you. Your doctor's given us some orders to do, and so we're going to be doing a little bit of work with that. Can you tell me your name and date of birth? So I validate his name and date of birth is John Fisher. Date of birth is 6/15/1927. Okay, how are you feeling today, Mr. Fisher? Do you have any pain? You want to be able to assess because you're going to be doing an abdominal wound dressing. He's post-op from surgery, been in the hospital. Okay, so the first thing we're going to do today, Mr. Fisher, is we're going to change the dressing on your belly from your surgery. Is that giving you much pain? No? You're pretty comfortable? Good. The nurse that took care of you last night told me that it looks like it's healing pretty well. I'm going to put your head down a little bit to make it more comfortable for the dressing change. Is that comfortable for you? Good. All right, now I'm just going to expose your belly. So, kind of go through your steps. I'm going to wash my hands. I'm going to put on gloves because I'm going to be taking off an old dressing. And I've provided privacy. I will tell you one thing is when you're doing your scenario, don't actually pull these curtains, because when you pull these curtains, what happens is you don't have enough room to move and you're more likely to contaminate something. So just say you've pulled the curtain to provide privacy. Okay, I'm just going to take this dressing off, moving a little bit of tape here. Now, when you do your scenario, this will not be an open wound, okay? This isn't the right thing. Take my thing, I'm going to throw the old dressing out. Your wound looks pretty good, Mr. Fisher. It has 16 stitches in it. The wound edges are nicely approximated. I'm going to just measure it to see how long it is. So I'm going to measure, okay, it's about 6 inches long. There's no active drainage. All looks good. So now I'm just going to go ahead and set up for the dressing change. I'm going to take my gloves off. I'm going to wash my hands. I'm going to set up my field for my dressing change. So I'm going to open my sterile container there. I'm going to put that in the trash. I'm going to use sodium chloride. It's a new bottle, hasn't been opened, so I don't need to lip it. The expiration date isn't until January 2017, so I'm okay. I'm going to open that. I'm going to pour that into my basin. I'm going to put that aside. Now, again, as you're doing this, make sure that you don't obscure the vision as you do the rest of your setup. I'm going to put some sponges, 3 sponges into my sterile basin. And see, these are the kinds of things that happen as you're doing your scenarios. So you would have to throw this out. You couldn't get, because that's going to be contaminated. So that's why practice is important, so you kind of know how these things open and go. Make sure you have a place to put your discarded stuff. Keep a couple of extra supplies close by so that if you do contaminate something, you don't have to go looking for it. So three sterile sponges in my solution with the sodium chloride. You can put the water in before or after you put the sponges in the bowl. It doesn't matter to me. This is my final dressing. I'm going to open that, leave that open. I'm going to prep my tape. And on my last piece of tape, I'm going to write my initials and date and time so that I know when that was done. Okay, so that I'm going to throw out. Now I'm going to put on my sterile gloves. And this is the other thing that's important when you're doing your wound care, making sure you have it set up in such a way that you have space to open your gloves and do it in a sterile manner. So I'm going to wash my hands again. I'm going to open my gloves. See, that's what I mean about making sure that you have a good pair. Okay, once you get your gloves on, you can, fix them with your hands. When you throw this away, pick it up by the middle, okay? The last couple of times I've had students pick it up by the edge, that contaminates your gloves. This is sterile, so you can pick this up and get rid of it, okay? Now, this is the other place where students have difficulty in the wound care. You know, clean, dirty, wipe, get rid of it, okay? So again, you want to make sure that you're not doing a lot of swinging around. You want to make sure, like my arms are long, so I'm good in this scenario. When you're practicing, make sure you're practicing on the side of the bed that you're comfortable practicing in. My left hand has a tendency to be my dominant hand, so that's why I want to use this to start with. If you're right-handed, you might find yourself comfortable on the other side, so make sure when you set up, you're set up for what you're comfortable. So I'm going to take my moistened 4x, clean hand to dirty hand, top to bottom in the container. Clean hand to dirty hand, top to bottom, get rid of it. Clean hand to dirty hand, top to bottom, and done, okay? Now, this is my dirty hand. I'm gonna put the clean dressing on top of the patient. So this hand becomes no longer usable because you wanna have your clean hand. So I'm gonna pick up the combi pad, I'm gonna open it, and I'm gonna lay it across the dressing. Once it's on the incision and the incision is covered, you're good. So at this point, if you choose to take your gloves off, you may, because the incision is covered, okay? I find it difficult to work with tape and gloved hands, so my tendency is that I'm gonna take the gloves off, I'm gonna put the tape across the dressing, so, and then you're done. Okay, that's your sterile dressing change. Questions?
Your hand went below, there's no, I thought there was like a level that...
You're supposed to keep it above the waist.
Yeah.
Okay, now, again, what I look for, the reason you keep it above the waist is because you're less likely to contaminate. So, you know, table should have maybe been a little bit higher depending on your height. I watch your hands. If you don't contaminate when you're doing this, as long as you don't touch something when you to contaminate, that's okay. That's what we're looking for. We're looking for that you don't contaminate. So, you know, where I get worried is when people put their gloves on and they start to kind of futz around here. You know, as long as you keep your, so when you come over to the patient, your hand should be up like this. And really in the operating room, that's what they do all the time. In real life, not so much. You know, and, you know, clean to dirty is important. What I see a lot of times happening is clean to dirty one pass and then like dirty into the basin. That's not okay.
It's dirty because you touched the...
Because you've touched the patient,
yeah.
You've touched the wound. Technically you haven't touched the wound with your gloves,
yeah.
but the gauze pad after you wipe the wound is dirty.
Okay.
So that's why it's clean to dirty. Okay? Other questions?
Yeah, see, you don't clean the inside of the...
So when you do your videotaping, it will look different than this. This is the wrong insert here. This will be closed when you do your videotaping, and there will actually be stitches there. Okay, this is just the wrong abdominal piece, and I couldn't find the right one, so that's why it looks like this. This is set up for a complex wound dressing where you'll actually pack it, but that's not what it will look like when you do yours. Yours will be in a closed incision with stitches in it. So what you're going to be wanting, you're going to count the number of stitches or staples that are there. You're going to look at whether or not the wound margins are together because you want to document that. And you're going to say no drainage, or there's some old serous drainage on the old dressing. So yeah, on this isn't what the actual wound will look like when you do your videotaping. Other questions?
If we forget supplies, can we get them as long as we're on camera?
Yes, you can get supplies, or say you need a third pair of gloves because you had trouble to putting the gloves on. You can just say, oh, I contaminated my gloves, I need to get another pair. Make sure you have it relatively easily accessible for yourself though, because where you get into trouble where you have to get other supplies